Have you been wondering if you have osteoarthritis? Maybe your knee, hip, or low back, or some other joint has been bothering you and you just want to figure out what the heck it is. Well, in this video, I'm going to tell you the top 9 signs that you might have osteoarthritis. There's not a particular test that you can do to know if you have the condition or not. It's honestly just going through some of these signs and symptoms and see if they correspond with what you have. Usually with these symptoms, if you just have a select 1 or 2, it may be something else. So it may be worth seeking out professional guidance just to make sure that you can rule out some other things. But if you can correlate with at least 4 to 5 of these symptoms, then you may have osteoarthritis. Now, it's important to know if you have it because then we can go over treatment options and then we can go over how you can stay proactive about it and prevent the progression of it. So without further ado, let's get started. So number 1 is joint stiffness, especially when you wake up in the morning. But one caveat being, after about 30 to 60 minutes, the stiffness tends to resolve. It tends to go away, and this is particularly with movement. So if you get up and you're moving around and you start to notice that that stiffness does start to go away, then that is a hallmark sign of osteoarthritis. Number 2 is after you do a lot of activity, say, walking a longer distance than you typically do, maybe you're on your feet for work for a few hours throughout the day. If you notice swelling, that's tied to activity levels, you could have osteoarthritis. One important caveat with swelling, though, is if you notice warmth and redness, swelling could also indicate a few other things. So swelling without that warmth and without that redness, that tends to dissipate after a few hours. Sometimes it may take a day or 2, but if it sticks around and lingers for longer than that, it may be a sign of something else, another injury or a potential even infection. Okay, so for number 3, when we're looking at how the pain starts, so it usually starts gradually. Take your knee, for example. You might start to notice it feels achy, it feels uncomfortable, and then maybe it gets worse over a couple of weeks, maybe even a couple of months. Some people try to ignore it, and then it doesn't particularly seem to just go away. This could be a sign of osteoarthritis. So it's a gradual onset. It usually doesn't come on super quickly. And it's usually not necessarily tied to an injury, like if you fell on it or something like that. There likely is something going on. Osteoarthritis is typically more of this gradual kind of progressive onset. Number 4 is it usually starts on one side of your body. So for example, sticking with the knee, if you notice that maybe your right knee starts to hurt and it starts to feel that achiness, starts to gradually get worse, and then maybe it could spread to the left one, or it could spread to a hip, or it could spread to an ankle, but it usually starts on one side, compared to conditions like rheumatoid arthritis, where it can start on both sides at once. So a lot of times you notice it in both hands, or you notice it in both knees or both ankles. So usually for osteoarthritis, it starts on one side. And if you do want to know the particular differences between osteoarthritis and rheumatoid arthritis, I do have a video on that I will put a link to. So number 5, you start to have difficulty with range of motion, meaning your joints start to become stiff and they don't move as well. They feel like they need some oil in them. For example, again, the knee, you start to kind of maybe not be able to straighten it, and bending may become a little bit harder. Same thing like in elbows or hands, you start to feel stiff and they start to feel hard to move. So you start to lose some of that mobility or that range of motion. Number 6, you might notice muscle weakness. A lot of times when we do have pain, it can inhibit certain muscles and it doesn't allow the muscles to work as properly. So commonly in joints like the hip, the knee, and even in the low back, you may experience some muscle weakness. The knee is typically the one that you may notice the most. Although if you have muscle weakness in the hip, you might notice that you start limping a little bit or start to get tired after just walking a certain distance. So you can notice this muscle weakness. Muscle weakness in the spine and back tends to kind of manifest as pain, having difficulty holding certain postures. But you may notice muscle weakness around the joint. And if you start to notice that maybe it feels like it's going to give out, or it feels you don't feel as confident on the leg that you're experiencing pain, it could be a sign of osteoarthritis. Okay, so for number 7, changes in weather that induce achiness. So for example, changing seasons, or maybe it's a rainy day, or maybe it's a very humid day, you may notice that your pain fluctuates with the weather. This can actually be a sign of osteoarthritis because of the changing barometric pressure. It can cause a little bit more friction between the lubricants in your joint, making it a little bit harder to move. So if you do notice that your pain seems to be tied to the weather, it may be osteoarthritis. So for number 8, this one is important to know just because it could be indicative of something potentially more serious or another condition if these symptoms are true. So with osteoarthritis, when you have joint pain, when you're experiencing this stiffness, that it's not particularly simultaneous with fever, a loss of appetite, fatigue. That's not necessarily tied to poor sleep or something like that. But if you have these symptoms, it could be indicative of rheumatoid arthritis or some other more serious conditions. So if you start to kind of feel ill or you start to experience some of these other symptoms, it's likely not osteoarthritis. So if you have pain that doesn't include fever, feeling ill, then it's likely osteoarthritis. Now, number 9, final one. If you start to hear joint noises, so this is particular in the knee, but you can also feel it in some other joints, especially as you're going through certain movements like squatting or going up and down the stairs, getting up and down from a chair. You may hear some creaking, some cracking, some crunching, also called joint crepitus. I have a video, especially if you are experiencing this in your knee, that you can go to after you finish watching this one. But if you have joint noises, it could be a sign of osteoarthritis. So we're looking at crepitus or noises. That aren't inherently harmful, especially if they don't hurt as you're doing them or as you're hearing them. Okay, so these are 9 common symptoms of osteoarthritis. Again, we want to look for clusters of about 3 to 4 at least that could indicate osteoarthritis. Again, there's not really a test, so we use these symptoms, but we like to have at least 3 or 4 of them. If you just have one of these, it could be indicative of something else. For example, muscle weakness. It could also be a sign of an injury, or it could also be a sign of something else, especially if maybe your entire body is feeling weak. So it's important to kind of look at all of these, look at your symptoms, and see if they correlate with one another. Now, if you have osteoarthritis, one of the first steps would be to find a healthcare provider that you trust that actually understands you. And I have a video here of how you can find the right osteoarthritis specialist to help you. This can be in the form of a primary care, it can be in the form of a rheumatologist. It's just finding someone that understands you and your goals. And then you can move into this video because it's going to be a beginner workout series, because the next step is finding movements that don't flare up your pain. And the earlier you can do this, the better, because the more proactive you are, then you can start to slow down some of these symptoms and start to slow down its progression. So I hope that this video is helpful. If it was, share it with someone who may also think that they might be dealing with osteoarthritis. And go ahead and hit that red subscribe button below, because if you do have osteoarthritis, I have tons of videos for you. Thanks for watching.